The Trust recognises the importance of providing the most clinically effective equipment to support the management of long bone fractures and will therefore be introducing the Prometheus Traction Splint. The new device will be introduced during early 2017 to 18 to all DCAs. The existing Sega or Donway splints will remain on vehicles until the 31st of March 2018, after which date only the Prometheus splint must be used. The key features of the Prometheus Traction Splint include one-person application in less than 2 minutes, traction pole adjusts to different sizes instantly for adult or paediatric use, no need to roll the patient, no uncomfortable ischial bar, it can be used concurrently with a pelvic splint, it's lightweight and compact, it's not restricted for use on mid-shaft femur unlike some other traction devices, and it can be used bilaterally. Apply the ankle hitch around the ankle with the stirrup strap beneath the foot. Secure the ankle hitch with the hook and loop strap. Tighten the stirrup by pulling on the green tab. Apply the thigh loop by unclipping the buckle and feeding the male part of the buckle behind the knee and slide up the leg. Clip the buckle together and tighten the strap so that the pole receptacle is positioned approximately at the patient's belt line. Lay the pole alongside the patient's leg with the dart at the foot end. Approximately one section of this pole should extend below the foot. The top end of the pole should now be inserted into the receptacle. Loosely apply the lower thigh strap by feeding the strap under the knee and fastening with the hook and loop material. Fit the yellow tab over the dart at the foot end of the pole. Stabilise the end of the pole by resting it against your knee and apply traction to the patient's lower leg by pulling on the red tab. Apply the upper thigh strap by placing it underneath the knee and sliding up towards the top of the thigh. Secure the strap using the hook and loop material. Adjust the lower thigh strap as necessary. Ideally, this should rest just above the patella. Place the lower leg strap between the ankle hitch and the mid-calf and fasten using the hook and loop material. The traction splint is now in position.
To document your assessment of the fracture, click on the Secondary Survey tab of the EPCR, then the Musculoskeletal tab, then the Assessment tab, and record your findings here. To record the application of the Prometheus Traction Splint, click on Treatment, then Immobilisation, and then Traction Splint. Here you can record where the splint was applied, whether there was distal circulation present, and time of application. Don't forget to consider the Major Trauma Triage assessment tool to assess your patient's injuries.